All right, let's dive into today's news. Healthcare and tech are on the docket. It's January 23rd, 2025, and we've got a lot to cover.
We do. A ton of articles to unpack. Health journals, tech publications. We even pulled some political
Sounds
analysis.
like a real mixed bag, but that's what we're here for, right? To break it all down.
Exactly. Let's get started.
Perfect. Well, first up, President Trump. Back for a second term and wasting no time in shaking things up, especially in healthcare. Executive orders coming in hot.
Yeah, it's really fascinating. He's rolled back ACA enrollment measures, pulled the U.S. out of the World Health Organization, and scrapped the drug pricing models put in place by the Biden administration, all in just a few weeks.
Wow, okay, so much to unpack there. But let's start with the ACA, those enrollment changes. What do those actually mean for people trying to get health insurance?
It could mean that health insurance gets a lot more expensive, maybe even too expensive for some people, especially those in states that expanded Medicaid under the ACA.
I see. And pulling out of the WHO, what kind of impact could that have?
Well, the U.S. has always been the WHO's biggest financial contributor, so this is a big deal, globally even. This could really affect their ability to respond to global health crises, like, pandemics.
So potentially a step back in global health leadership for the U.S.
Potentially, yeah. It's definitely a concern for a lot of people in the health community. This could impact the fight against diseases and efforts to improve health all over the world.
Okay. And lastly, those drug pricing models that were scrapped. How could those changes affect us?
This is really complex, but basically, getting rid of certain pricing controls could mean drug prices increase. It'll affect people who need regular medication for chronic conditions. Think about people with diabetes or heart disease.
So a lot of uncertainty right now.
Absolutely, yeah.
Yeah.
The effects of these decisions are going to be felt everywhere.
Okay. Well, let's move on to something a little bit more upbeat. How about some tech?
Yeah.
AI seems to be everywhere these days, especially in healthcare.
It really is. It's incredible, all the new stuff. Like, there's this research using AI to track opioid-related problems in hospital ERs, with the opioid crisis and everything. That's a big deal.
Yeah. Catching it early is so important.
Yeah.
That's amazing. What else is out there? Anything else catch your eye?
Oh, yeah, tons. There's one team developing AI-powered smart beds. They're outfitted with sensors and algorithms that constantly monitor the patient's vital signs, sleep patterns, even falls.
Wow. Like having an extra set of eyes all the time.
Exactly. And while all this is really promising, we also have to think about the ethical concerns that come with using AI. Data privacy, bias in algorithms, people losing their jobs. We've got to be careful.
It's all about balance, right? Embracing the good, but also doing it responsibly.
Exactly. Making sure technology serves us, not the other way around.
Well said. Now, shifting gears a bit, the World Economic Forum is sounding the alarm about something else entirely: the global health gap between men and women.
Yeah, their latest report is pretty alarming. It highlights the differences in health outcomes between genders. They've identified 9 health conditions where women are at a disadvantage. Some serious stuff: breast cancer, cervical cancer, heart disease, even pregnancy-related issues.
It's a huge problem impacting women's lives, their health, how long they live.
Exactly. But the WEF doesn't just point out the problems. They lay out 5 areas where we need to act. First, better data on women's health. Second, more research focused on women's health. Third, healthcare that takes into account gender differences. Fourth, making sure these efforts reach all women, even in marginalized communities. And finally, more resources for healthcare and better ways to deliver it.
Wow, a comprehensive approach.
Yeah.
It's like they're saying, hey, world, we need to take this seriously.
Yeah, it's encouraging to see this kind of attention on women's health globally. It's about time. Prioritizing the health of half the world's population, it's kind of a no-brainer.
I couldn't agree more. All right, we've covered a lot of big news, but let's dive deeper into some of these key issues.
Okay, let's do it.
First up, let's circle back to the Affordable Care Act. It seems like everyone's talking about it, especially with Trump targeting it. But what's the situation on the ground like actually happening?
Well, amidst all the political back and forth, covered California, the state's ACA marketplace, they're reporting record enrollment.
Really? So even with Trump trying to undo the ACA, people are still signing up for coverage.
They are. It seems like those enhanced federal subsidies and more state aid for those out-of-pocket costs have made health insurance a lot more affordable, at least for people in California. But, well, there's a catch.
There's always a catch. What is it?
These subsidies, the funding, it might not continue. The new Congress, it's Republican-led, and they might not extend those subsidies beyond 2025. So all those enrollments could be very short-lived.
So it's all up in the air. Millions of people could lose affordable health care. This is definitely a story to watch.
It is. Now, something else we should talk about that maybe doesn't get enough attention, cybersecurity in healthcare.
Ooh, yeah. I've been thinking about that a lot lately. All those data breaches. Healthcare organizations just seem like prime targets for hackers.
Right. I mean, think about it. They have so much sensitive data, medical records, financial info, social security numbers. It's like a gold mine.
And this isn't just a one-off thing, right? This is a growing problem.
It is, for sure. A recent report highlighted just how vulnerable these organizations are. Remember the Change Healthcare attack last year? Millions of records exposed. Operations shut down for weeks.
Oh, yeah. That was huge.
This report suggests that that was just the beginning. Over 20% of healthcare organizations had to replace senior leaders following a cyber attack.
Wow, I had no idea. The consequences are serious.
Yeah, they are. Reputational damage, financial losses, disruption to patient care. It's a mess.
So what can be done about it? How do we make things more secure?
Well, it's not easy. It needs a whole system overhaul. Right. Organizations need to invest in better security systems, train their employees, have a plan in place in case something does happen.
So it's on the individual organizations. But is there a role for government? Or even industry-wide collaboration?
Yeah.
To, help prevent these things?
Oh, absolutely. Imagine a system for sharing information about threats, or setting industry-wide security standards, sharing best practices. Working together would be a huge step forward.
Yeah. We need to make this a priority. This data is just too important to risk.
You got it. Now let's head back to AI. We talked about the exciting applications, but the elephant in the room is the cost. All of this cutting-edge tech, it can't be cheap.
No, it can't.
Yeah.
So what are we talking about here? What are the major costs of all this?
Well, cloud computing is a huge one. All the data images, health records, genetic data. Healthcare organizations rely on the cloud to store and process all of it, which is crucial for AI. But it's not free. Those costs are adding up.
Especially as these AI projects get bigger and bigger.
Exactly. And some healthcare systems are struggling to keep up. It's a real concern. Yeah. Is the price of innovation becoming a barrier to using AI, to really making a difference in healthcare?
It makes you wonder if it'll become a luxury, something only the wealthy can afford.
Yeah. Some experts think that cloud costs can be managed. But it's a conversation we need to have, especially as AI becomes more and more common.
Sounds like we're at a real crossroads. AI has so much potential, but we need to make sure it's sustainable for the whole system.
Definitely. Okay, before we move on, I just wanted to share a few quick things, just some interesting news I came across.
Oh, I love those. Hit me.
All right, well, first up, bladder cancer. Researchers have developed a new at-home test for it. And get this, it's apparently much more accurate than the existing tests. This could be a game changer for early detection.
Early detection is everything. That's fantastic news.
It is. It can literally save lives. Okay, second one. This is mind-blowing. Scientists are making progress creating artificial touch sensations for people with spinal cord injuries.
Wait, what? Seriously? That sounds like science fiction.
I know. They're using these brain-controlled bionic hands, and they can convey complex touch sensations. Edges, shapes, movements. Imagine being able to feel those things again after losing the ability.
That's incredible. So how far along is this? Is it still, experimental?
It's still in research, but the results are really promising. They can perceive shapes and textures, even movements, all using this bionic hand.
Wow. It's not just an on or off switch. It's like they're recreating a real sense of touch.
Yeah.
This could be life-changing for so many people.
It could. Think about picking up a cup, buttoning a shirt, even just holding someone's hand, things we take for granted. Okay, ready for number 3?
Hit me.
Okay, this one might make you want to grab another cup of coffee. A review of almost 100 studies suggests that coffee, your morning coffee, might have anti-aging benefits.
Wait a minute, hold on. Are you saying my daily caffeine fix is the key to a longer life?
Hold on, not so fast. It's not a guaranteed fountain of youth, but coffee does have antioxidants and polyphenols, those compounds linked to all sorts of good things. Reducing inflammation, protecting cells, even boosting brain function.
So more than just a quick energy boost.
It seems that way. We need more research, of course, but it's interesting, right? Maybe your morning cup is a mini time machine.
I'll take it. So let's recap. We've got Trump shaking things up, AI making waves, and a renewed focus on women's health. Plus, record ACA enrollment but with an uncertain future, the threat of cyber attacks, and those amazing scientific discoveries.
That's a lot to digest, but that's the world we live in, right? Always changing, and it's important to stay in the loop.
It is. And we've only just scratched the surface. There's so much more to uncover.
So you ready to dig a little deeper?
Absolutely.
Oh,
We were just talking about the cost of AI in healthcare, and I think it's worth spending a little more time on that. It feels like there's this tension between the excitement over AI's potential and then, well, the reality of what it actually costs.
yeah, that's the big question. We're at the edge of this revolution, but can we actually afford it?
Right. So what are we talking about here? When we say cost, what are the specific things that make it so expensive to use AI in healthcare?
It's a few things, really, but the big one is data. You need so much data to train these systems, and then even more to run them. Medical images, health records, genomic data, it's a lot.
So storing and processing all that data, that's where the cost comes in.
Exactly. A lot of organizations are using cloud computing to handle it all, but those services aren't cheap.
And those costs will just keep going up as AI gets more sophisticated, needs more data.
That's the worry. Some people say we can manage the costs, but it's a conversation we need to have, especially as we move forward.
It also makes you think about equity. If only the wealthy healthcare systems can afford this technology, it could actually make things worse, widen the gap.
Exactly. We have to make sure this benefits everyone, not just the few.
Right. Okay, let's move on. There's been a lot of talk about Robert F. Kennedy Jr.'s appointment as head of Health and Human Services.
Yeah, it's definitely a controversial choice, especially his views on vaccines.
Right. So for our listeners who haven't been following this closely, can you break that down? Why is his appointment causing so much concern?
Well, Kennedy has been vocal about his views on vaccines. He believes they're linked to autism, and he said so publicly many times.
That's a theory that's been disproven, right, by a lot of scientific research.
It has, yes, many times over. But he still promotes this idea, and that's why this appointment has sparked so much debate, especially within the medical community.
Right, because it could actually undermine trust in vaccines.
Exactly. It's a real concern. We're already seeing some vaccine hesitancy, and this could make it worse.
Vaccines are one of the biggest successes in public health history, so to see that trust eroded would be a real shame.
It would be a big step backward.
It'll be interesting to see how this plays out. The confirmation hearings, I'm sure they'll be pretty intense.
I'm sure they will, and the outcome of those hearings will have a huge impact on public health policy going forward.
Okay, let's shift gears a bit and talk about a trend that's been really concerning: healthcare bankruptcies.
It's a pretty sobering sign of the times. A lot of healthcare organizations are under immense financial pressure.
What's causing this? Why are so many struggling?
A lot of reasons. Labor costs are rising, supply chains are still disrupted, reimbursements from the government and insurance companies are going down. It's creating this perfect storm.
Wow, a perfect storm of bad news.
Pretty much. And these bankruptcies have a ripple effect.
How so? What are the consequences beyond the organizations themselves?
Think about a rural area where the hospital is the biggest employer. If it goes bankrupt, people lose jobs. Healthcare access is disrupted. It impacts the whole community.
It shows how important healthcare is, not just for individual health, but for the economy, too.
Exactly. Okay, so let's talk about primary care.
Yes, primary care. It's so important, but it seems to be facing a lot of challenges.
Yeah, for years it's been kind of overlooked, even though it's the foundation of a good healthcare system.
So what's going on? What's causing these challenges?
Part of it is the way we pay for healthcare. The fee-for-service model. It encourages more procedures, more specialist visits, and primary care gets undervalued.
So it's rewarding quantity over quality, in a way.
Kind of, yeah. And that leads to underfunding, less investment in primary care. And primary care is all about preventing illness, managing chronic conditions. It's the front line.
And it seems like we're paying the price now for that lack of focus.
We are. The American Academy of Family Physicians put out a report recently. They're calling for more funding, expanding what family physicians can do, and more support for telehealth.
Sounds like they have some good ideas. Hopefully people are listening.
Let's hope so. Strengthening primary care is absolutely crucial for a more sustainable system, a system that's fair for everyone.
Okay. Switching gears again. Mental health care. This is something that's been in the news a lot lately, and for good reason.
Yeah, it's a critical part of healthcare, but so often overlooked and definitely underfunded.
So what are the main challenges? What's making it so difficult to get good mental health care?
Well, Well, there's just not enough mental health professionals, especially in rural areas and underserved communities.
So people are struggling to access care even when they need it desperately.
Exactly. And even when they do find someone, they often have to wait months for an appointment. And then they're hit with high out-of-pocket costs.
It's a system that's failing the people who need it most.
It is. And we're seeing the effects of this neglect all around us. Mental illness is on the rise. Substance abuse is up. Suicide rates are increasing.
It's heartbreaking. So what can we do? What needs to change?
We need to invest more in mental health services. We need more training programs to get more mental health professionals out there. And we need to change the way we talk about mental health, reduce the stigma.
It's about recognizing that mental health is just as important as physical health.
Absolutely. And building a system that supports people's mental well-being so they can live full, healthy lives.
Yes, exactly. And that brings us to another important issue. Health care for immigrants.
Yeah, it's already a complex issue, and all the recent changes in immigration policy have made it even more so.
What are the biggest concerns right now? What are people worried about when it comes to immigrants and healthcare?
Well, one thing we're seeing is that immigrants are afraid to seek care, even when they need it, because they're worried about immigration enforcement.
So they're being forced to choose between their health and their safety.
Pretty much, yeah. And that can have serious consequences, not just for them, but for public health in general.
What do you mean?
Imagine someone has a contagious disease, but they're too afraid to get treatment. That could easily turn into an outbreak.
Oh, wow. That's a scary thought.
It is.
Yeah.
And we're also hearing about hospitals being asked to collect information about people's immigration status, which, that just adds to the fear and makes people even less likely to get help.
It creates this climate of distrust.
Exactly. And it goes against the idea that healthcare is a human right.
Right. It shouldn't matter where you're from or what your status is. Everyone deserves access to care.
I agree. Okay, so let's talk about telehealth for a minute.
Telehealth, yes. It's definitely become more popular, especially since the pandemic.
It has. It's a game changer.
I've used it myself. It's just so convenient.
Convenience is a huge plus. You can talk to your doctor from your own home, which is especially helpful for people in rural areas or people with mobility issues.
And I'm guessing it's probably cheaper than an in-person visit.
Usually, yeah. If you can avoid unnecessary trips and hospital stays, it saves money for the patient and the healthcare system.
So a win-win.
Pretty much. But there are some downsides, things we need to figure out.
Like what?
Well, not everyone has access to the technology they need, or even good internet. We have to make sure telehealth is accessible to everyone.
Right. And what about privacy? Making sure all that data is secure when you're using these online platforms.
That's a big one. We have to address that too. But overall, I think telehealth is here to stay. It has the potential to really change things.
Okay, let's talk more about AI.
Right.
We've already discussed the cost, but I want to get into the actual applications. How is it being used in healthcare right now?
Well, one of the most exciting areas is diagnostics.
Yeah, I've heard about AI being used to read X-rays and things like that.
Right. They can look at X-rays, CT scans, all kinds of medical images, and they can often detect things earlier and more accurately than a human radiologist can.
So it's like having this second opinion, this superpowered second opinion.
Exactly. But it goes beyond just images. AI is also being used to personalize treatment plans.
Oh, wow. Tell me more about that.
Think about it. Treatments that are designed for you specifically, based on your genes, your lifestyle, your environment. That's what personalized medicine is all about. And AI is making it possible.
So it's moving away from that one-size-fits-all approach,
Yeah.
which, let's be honest, doesn't always work.
Exactly. And AI is also being used to make the whole system more efficient, automating tasks, streamlining things so that healthcare professionals can spend more time actually caring for patients.
That all sounds great, but I have to ask, what about the ethical side of things? With a technology this powerful, there must be some concerns.
Oh, for sure. We have to be really careful how we use this technology.
What are some of the biggest ethical concerns?
Data privacy is a big one. These AI systems need so much data, and we have to make sure it's protected. And then there's bias. If the algorithms are trained on biased data, they're going to reflect that bias in their decisions.
So it could actually worsen existing health disparities.
Exactly. And then there's the impact on jobs. We have to think about what happens to healthcare workers as AI takes over some of their tasks.
Right. It's all about finding that balance, using AI to make things better, but making sure it benefits everyone.
Exactly. Okay, let's shift gears again and talk about long COVID.
Oh yeah, long COVID. We're still dealing with the effects of the pandemic, even years later.
We are. And long COVID is this complex, often really debilitating condition that can stick around for months, even years, after you've recovered from the initial infection.
We're still learning about it. But what are some of the most common symptoms? What do people experience with long COVID?
Well, it varies a lot from person to person, but some of the things we see a lot are fatigue, brain fog, shortness of breath, joint pain, and trouble concentrating.
So it's not just a respiratory thing. It can affect different parts of the body.
It can, yeah. And it can really impact your life,
Yeah.
your ability to work, to socialize, to enjoy things. It's a big deal.
What's the latest research saying? Anything new we should know about?
Well, some studies have found that women and people who have had multiple COVID infections are more likely to develop long COVID.
So some people are more vulnerable than others.
It seems that way, and researchers are working hard to figure out why that is.
Hopefully they'll find some effective treatments soon.
I hope so. It's a reminder that the pandemic isn't really over. We're still dealing with the consequences.
Okay, so let's talk about something that's been an issue for a long time. Rising healthcare costs. It just seems like it never goes away.
It's a really tough problem to solve.
Why is healthcare so expensive in the U.S.? What's driving those costs up?
It's a bunch of things. The way the system is organized, the price of drugs, the aging population, it's a real mess.
So there's no easy fix.
Not really, no. But there are things we can try. Making prices more transparent, negotiating lower drug prices, making the system less complicated. There are ways to make it better, but it will take time.
It sounds like we need everyone working together to solve this. Healthcare providers, policymakers, even patients themselves.
Absolutely. Okay, so let's talk about community health centers. They play such an important role, especially for people who don't have a lot of resources.
They do. They're kind of a lifeline for so many people. So what are some of the challenges they're facing? What makes their job so difficult?
Well, funding is a huge one. They rely a lot on government grants and Medicaid, and often it's just not enough to meet the needs of their patients.
So they're constantly struggling to make ends meet.
They are. And on top of that, they're seeing more and more patients as more people lose their jobs and their insurance.
It's a tough situation.
Okay.
But they keep going. They provide essential care to those who need it most.
They do. They're real heroes.
Okay. Let's talk about something that's actually pretty empowering. Healthcare consumerism.
Yeah, it's about patients being more proactive, taking control of their health, making informed decisions about their care.
I think that's a good thing. We shouldn't just be passive recipients of care.
I agree. It's about being informed. And there are a few things driving this trend. Healthcare costs are going up, there's more information available online, and people are using these wearable health trackers.
So people have more information than ever before, and they're using it.
They are, and they're demanding more from their healthcare providers. More transparency, more choices, more personalization.
So it's changing the relationship between patients and providers.
It is, and healthcare organizations need to adapt. We need to create a system that puts the patient at the center.
Absolutely. Okay, let's talk about something that doesn't always get enough attention. Social determinants of health.
Right, the things that influence your health that aren't medical care.
Exactly. Like where you live, what you eat, your level of education, your income, all of those
Like,
things.
all of those things can have a huge impact on your health, even bigger than medical care sometimes.
So we can't ignore them. We have to address these social and economic factors if we want to improve health.
Absolutely.
So what can we do? How do we address those social determinants of health?
Well, it takes a community effort. Investing in affordable housing, making sure people have access to healthy food, improving education and job training programs.
So it's about building healthier communities from the ground up.
Exactly. It's not just about individual responsibility. It's about creating a society that supports health and well-being for everyone.
Wow. So we've covered a lot, haven't we? From political decisions to AI and even the things in our everyday lives that affect our health. It's a lot to take in.
It is. And it's easy to get lost in the details, you know, to miss the forest for the trees.
Right. And that's what I love about these deep dives. We get to zoom out, see the bigger picture, understand how all these things are connected, and what it means for the future of healthcare.
I agree. We talked about the challenges, the rising costs, the disparities, the workforce shortages. But there are also some positive things happening, like those AI breakthroughs, the growth of telehealth, the focus on prevention and mental health.
And speaking of mental health, I think it's worth circling back to that. Mental health parity, it's not just a policy issue, it's about our values.
Absolutely. It's about asking ourselves some tough questions. Are we really treating mental health as seriously as physical health? Are we willing to put our money where our mouth is? to break down the stigma.
It's a call to action, really, to
Yeah.
be more compassionate, more understanding, to support people who are struggling.
Couldn't have said it better myself. Okay, so before we wrap things up, I want to leave you with something to think about. What if the biggest healthcare innovation, the thing that really changes everything, isn't a new drug or a fancy device?
Okay, I'm listening. What if it's not about technology at all?
What if it's a change in how we think about health, not just as the absence of disease, but as a state of complete well-being, physical, mental, and social?
That's a really different way of looking at it. It's not just about fixing what's broken. It's about being well in every aspect of your life.
Exactly. Imagine a world where we put as much effort into prevention, into healthy lifestyles, into addressing those social factors as we do into treating diseases.
That would be amazing.
Uh,
But it would require a huge shift in our priorities and our thinking and how we build our communities.
It would, but I think it's possible. And it starts with us, making healthy choices, speaking up for policies that support well-being, and creating communities where everyone can thrive.
So as you go about your day, your week, think about that. You're not just a passive patient. You have the power to shape your health and the health of your community.
Stay curious, stay informed, and stay engaged. Your health and the health of our world depends on it.
That's a perfect way to end our deep dive. Thanks for joining us, and until next time, stay healthy.